percussional sound under symmetrical points. Put your hands on your head. Oh, two. Here, or speaking about lateral side, only in intercostal spaces. Oh, I think it is not very convenient to make like this. Yes, better. Stop. Dancing man. Oh, down. Yes. One. Round, please. Put off your hands. The same situation with posterior surface. Next part for our percussion is interscapulous region. And this is the sign for what? Yes, for cross inflation's hand. Please cross your hands. No.
Cross your hands.
Relax. Yes. Look, the next peculiarity of competitive percussion. It's not smooth surface, as you know. That's why it's not comfortable to press your finger in so mounting place. Yes, that's why in interscapulous place we should put our plesimeter parallelly not to the floor but to the vertebrum, like this. Put again your hands, and under scapulus the technique is common, parallel to the floor, under the intercostal spaces only. Yes. My conclusion. During the competitive percussion, we find the resonant sound under symmetrical points of thorax. It's normal. Okay. If our patient suffers from the disorders of respiratory system with some pathological syndromes, of course, there are many differences of percussional sound. Yes? Okay, what can you say? Remember please the information about the providing properties of different tissues. As the tissue is duller, what's happened with the providing of sound? Better or worse?
Worse.
Dull tissue. What dense? Yes. As tissue denser, as their providing properties are better. Yes. Remember the information from the class about palpation. Yes. And tell me please, if our patient suffers from the syndrome of lobar inflammatory lung consolidation, what's happened with percussional sound?
Not symmetrical.
Dull sound. Yes, good for you. Duller. And what about the pneumothorax?
Sharp.
Yeah, good for you. Segmental inflammatory lung consolidation. Yes, mixed sound, good for you. Mixed sound. The inflammational lung tissue with healthy lung tissue around the inflammational one. Yes, mixed sound. Yes, the resonant sound with the dull voice. Yes. Okay. And the third thing which we can find with the help of percussion is the excursion, breathing excursion of bottom part of lung. How can we do it? Round again. And one step here. Please, do you allow me to put on your body 3 points with the help of my hand? Okay? Okay. How can we do it? Tell me please, what is, if it is necessary, or we should do it through all topographical lines? But usually the most the best moving borders of lung is the bottom border through the medium axillary line and posterior axillary line. Yes, good for you. This right around. Put your hand on your head. I show you this technique through, for example, posterior axillary line. First of all, 3 steps. First of all, we should find the bottom border of the lungs during the calm breathing. Little advice for your practical work. If you want to make some manipulations with patients during his or her calm breathing, don't ask, please breathe calmly. What is it calming? Patients begin to be a little bit nervous and deeper, not so deeper, not silence. And let's begin this process. So, if you want to do any manipulations during the calm breathing, do it without any comments. Like here, the difference. Here or not? Where is the border? Upper. Yes. Okay. Next step. Don't touch off your finger. And ask the patient to make a deep inspiration. Make a deep inspiration and stop breathing. Yes? Breathe, please. Don't forget to do this comment. Don't, oh yeah, I find the border, and the patient is in asphyxia. What is the bottom point of bottom? Upper, good for you. Don't forget, in this point, before the making of deep inspiration, don't touch away your finger. If you forget about it, please, once again, from the beginning, maybe here, maybe, oh, somebody here, oh. And the examiner begin to be in